So let's move over to your side of things, and this is the employer's interface. So here we've got the details showing. I've just done a quick search to look for employers across GM who have currently got active job vacancies for general practitioners. So I'll just scroll this down so you can see we've got a range of practices showing that they've got active job vacancies looking for general practitioners in different locations across GM and with links across to their job vacancies. So I'm just going to show you now what the employer profile. So as an individual, I'm interested in becoming a GP. I can see that there are job vacancies. I click on one of the employer profiles and here we go. So unfortunately, Sue isn't with us today for me to ask permission to show the profile, but I'm hopefully should be okay with me showing profile about Millgate Healthcare Partnership. And we can see here that there's a couple of job vacancies and we can connect through to those job vacancies and that'll take us directly through to the job vacancy listing as it appears on NHS Jobs. So we can see that the closing date is coming up 14th. At that point, what will happen is the job vacancy will literally disappear from the profile. Obviously, the other job vacancy that's showing as closing on the 28th will still appear and still show up in searches. Just to show you another quick one. One of the other practices that was listed was the Royton and Crompton family practice over in Oldham, and we can see details there. And once again, we can go to the job vacancy advert and get that information direct from NHS Jobs. So one of the things we wanted to discuss with you today, and I think Kerry's probably going to pick up in terms of questions, was whether you as practice managers are actually happy to have your names and email addresses exposed to people who are looking for employment. We have offered the functionality to individuals for them to be able to both hide their name and email if they want to, just like we saw on my profile, but we've also offered them the facility to actually hide their profile completely. And what that means is that their profiles will not appear in any searches and employers won't be able to connect with them. But we felt it was important from a privacy point of view that we did actually offer that opportunity. So one of the questions we'll be asking is, do you want the facility to be able to select yes in answer to the question, do you want to hide your name and email address? I'll stop there to let Kerry ask some further questions.
Yeah, so we have actually got a Mentimeter, but because we're gone slightly out of sync with our agenda, we're going to do the Mentimeters after the GM primary care team have joined us and delivered their presentation. So just kind of a quick show of hands in the chat. Do you think this would be helpful to you? Kind of, you can kind of put some information in the chat, no problem. It's basically a digital matchmaking tool, and it's hopefully to kind of take some of the pain out of some of the recruitment.
So Kerry's absolutely right. I mean, based on this screen that we're seeing here now with the practices that have got GP vacancies, what happens when an individual registers looking for work, they'll receive details of these practices that have got current active vacancies. Equally, the practices will receive details about individuals who are registering and looking for work. And so there's an opportunity for that connection to be made.
So actually, Rowan, in the chat, people are saying, yes, it's useful, but Dave's raised a really interesting point, saying it looks good, but it would be useful to have the ability to hide profiles when they're not actually recruiting.
Yeah, okay. So only show the profiles of practices when they're not recruiting. Do you?
Yeah. So it's just sort of, sorry, it's me that put the comment on. It just, it would stop people sort of using it as a database of basically every practice in GM and just spamming people for various things that you just don't need, So it would give you the ability to then almost turn it on and off. So say, right, I'm looking for people now. I want everyone to see me. And then in that dream scenario, when you've got absolutely 0 vacancies, which I'm sure happens once in a blue moon, you could just sort of like you do in LinkedIn, just sort of take your profile away and say, I don't need to be contacted by anyone anymore. And then you can just put it back on when you're looking for someone again.
Okay, well, that probably, Dave, the function that we've built that enables an individual to say that they want their profile to remain private, we could extend that to the employer profiles. So we could say, yeah, you can make yourself private, and also if you want to, you can, if you didn't want to be fully private, you could say, actually, I want to make my name and email address private, and then in that way, the data about the practice is really the data that's on the web, on the practice's website. It's the mailing address, it's the telephone number, it's the website address, that type of thing.
Yeah, that sounds good.
Okay, fantastic. So that is something that we can do. I suppose in terms of there are jobs already listed on the GM Careers website, which I'm sure some of you are familiar with. That enables you to post any jobs that you've got for free, and it's also linked into NHS jobs. So we've already set up the profiles, as Rowan's touched upon. So what we need you to do is take control of your own profile, and I'm going to put you a little link in the chat, and it will be shared fully in the slides. So that when you've got a vacancy that you want to go through the matchmaking service on, you can basically kind of take control of your own profile. There's a really clear slide in the information that I'll be sending out to you, so hopefully that will help describe what needs to happen next. We have reached out to a number of the doctors that are about to qualify with support from HEE, and we will be asking those newly qualified doctors or those that have qualified within the last 12 months to automatically register on the GM Connect as a way of identifying work across Greater Manchester. So hopefully that will help support you recruit GPs. In terms of admin and nursing staff, so we have got a database of those individuals that have helped out in the vaccination sites, and whilst we acknowledge that some of them will have been doing that on top of their current work, there are a number of individuals that actually it's been their only source of work. So again, we've reached out to them to ask whether or not they're looking for a job and to ask them to register and create a profile. So it's a little bit of kind of two motorways running at the same time. Whilst we're launching it to you and encouraging you to create your own profile, in the same respect, we're reaching out to people who are looking for a job and asking them to kind of create their profile. So hopefully when you go to post a job, there are people there that are looking. But like all of these things, it's open to improvement, and we would absolutely ask for your feedback in terms of how useful it is, how easy it is to use, so that we can just make the tool better, really. Fantastic. Has anybody got any questions for Rowan or the workforce team around the Connect? Brill. All right, well, what we'll do, we'll move on. Like I say, it'll all be in the slides with information, so hopefully you'll have that anyway. And I'm going to hand over to Dominic Anderson, that's from GM Excellence. Dominic, are you there?
Hi, Kerry, I'm here.
Hi, Dominic, thank you. Do you want to share your own slides?
I will. Hi, everyone. Thanks for inviting me today. I'll just bring the slides up. It's only a very brief presentation. So I'm the Health and Wellbeing Programme Manager for GM, and it's a pilot programme. I'll just give you a bit of background. There are 4 key elements to it. First of all, the Health and Wellbeing Hub, which is a website dedicated to the resources and tools that are available to support the primary care workforce. I've got a link to the website later on, so you can have a look. And it's going to be in development, constantly adding new information and new links to what's out there to support the workforce. But be really good if there's anything that you're aware of that you think would be useful on the website, if you could share that with me. The email address, the dedicated email address, is also coming up in a bit. We've got GM Families, which is developing support networks and networking opportunities for the whole workforce. It's about providing a space for people to share their experiences, share ideas, share how they're feeling, that kind of thing. It's really flexible around how it could be developed. I mean, there are existing networks, obviously, like this one, but we could look at developing networks around practices, neighbourhoods, PCNs, discipline-specific, similar roles across all parts of primary care, because the programme is actually covering ophthalmology and dentistry, community pharmacy and general practice. So we're looking at how everybody can work together to provide that support around health and wellbeing. We're looking at developing support sessions. We're looking at how we can target those managers and workforce, and again looking at resources and tools for teams and individuals, and also providing wider support through webinars and podcasts, which are starting imminently. And one of the initiatives which we're starting, and you may have seen something around this, is around providing some support to develop health and wellbeing champions. And we're looking at providing Connect 5 training as the initial step towards that, to give people the skills, knowledge and confidence to have better mental wellbeing conversations within the workplace. And that may also extend to working with wellbeing guardians at another level. And then the other element, the fourth element, is around recruitment and retention. We have got some additional support within the programme to give additional expertise around recruitment and retention, but we're looking at what training opportunities we can provide, and ultimately linking into the Greater Manchester Occupational Health Service when that's up and running, hopefully by the end of the year. So that's a really brief summary, a key overview of the programme, but we're really wanting to get feedback from primary care around what you think will be useful to get from the programme. So it's in no way limited to what I'm talking about at the moment. And we're open to having conversations, and hopefully this is, part of the conversation that we can have around what you think health and wellbeing looks like and what support would be useful to you and your workforce. So in terms of progress to date, I've been in place as the full-time project programme manager since about 3 weeks ago. So I'm here to coordinate what needs to happen and take your feedback and be a resource for yourselves to contact to try and make things happen within the limited time of the pilot, which finishes currently at the end of March next year. We've been sending out communications by email, which I know isn't brilliant for everybody, but it's the start of trying to contact people, and we're really open to trying to find better ways to communicate with you than sending you emails. So please let us know if there are good ways for you and for us to connect together and have that conversation. But that includes the Connect 5 training offer, and we've got it's about 50 people signed up now who are interested in doing the training, which is starting on the 16th of November, but that's just the first date. We're going to have multiple dates available over the next few weeks. And the Health and Wellbeing Champions will provide that kind of link within a practice or within a defined area. And it's a self-defined role as well. The role of the champion is defined by the interests of the individuals who want to take on the role and the needs of the workplace. And then we can provide ongoing support, training if necessary. But it's a really flexible role to be a focal point for wellbeing and signposting people into the resources that we'll have available, including on our website. And then the last comms, we also included a really brief wellbeing temperature check on SurveyMonkey. It's about a 2-minute temperature check, just to try and see how people are feeling, get a snapshot at this point in time of how people are feeling, but also to ask people what they want to get from the programme and what we can do in terms of developing. It's really about scoping and testing what will work and trying to develop that based on the evidence of what does actually work and what people would like to see developed. And as I mentioned, we've got the Primary Care Excellence email address and the website for you to communicate with us and for us to get the information out there. We've been doing a series of engagement meetings. Obviously, this is one of them. We've been to the programme boards and all sorts of meetings, and we're really trying to get out there and spread the message that this programme is currently live, and we're looking to work with people and to engage people and to make sure that people are aware that we can work with you on any health and wellbeing initiatives, And there are different things going on within the different disciplines of primary care at the moment, so we can share some of that across the disciplines to kind of share what's working and maybe share learning, which would be really a focal point for this programme and the evaluation of it. And then I've mentioned the podcast. So the first ones are being recorded this week, which includes the Greater Manchester Wellbeing Toolkit. And we're also doing some with Aqua this week, including psychological safety and managing change. I'm really open to suggestions for what we do. And I know that electronic means of communication and other forms of webinars and podcasts are not for everybody. But we're constantly looking for other wellbeing initiatives that we can provide access to that are away from that. So there's going to be a portfolio in terms of an offer for wellbeing that people will be able to access based on their interests and needs. So that's a very brief overview of the presentation. And those are the questions that are in the mentee that's coming up. Really, we want to understand how best to communicate what the barriers are and what your priorities are around wellbeing support. And just at the bottom there, there's the website and the email address if you'd like to communicate with us and see what information we've got there. The website already includes some wellbeing resources from GM and from the national offer. So
Thank
that's
you, Dominic.
Thank you.
So I've put the Mentimeter link in the chat. Jonathan's going to share his screen so we can see your responses, and obviously we'll share this after the meeting as well. So if you can go to www.mentee.com, and the code to use is 28283214. So if you can share your thoughts in response to Dominic's questions. So is email the best way to get hold of you, or is it forums like this, kind of pockets of information that we can send out to you?
Every possible way to communicate is useful to us. I mean, we want to know what's the best way for you, really. Certainly you can use the email address, the Primary Care Excellence website email address, which will get to me and is a single point for you to use to give me any feedback, and we can build that into the way we develop the programme. But if there are other forums, then please let me know.
All right, so I can see that somebody's got the hand up. Try and find out. Michelle, you've got your hand up.
Hiya, Kerry. I don't know what everybody else's has come up with, but mine's the first question is, have you employed a pharmacy tech when I put that code in?
Oh, not got round to that yet. Okay, I tell you what then. Let's do the Mentimeter right at the very end, because that will do a summary for us of all the presentations. If that's okay with everybody, if that's the way that it's presenting to you, I'll click on my phone in the background and just have a little look to see what it's looking like for me. But thank you for that, Michelle. Okay, so sticking with the health and wellbeing theme, I'm going to hand over to Shenny while we have a little look in the background of our technicalities around Mentimeter. Over to you, Shenny. Thank you.
Hi everyone. Hopefully you can hear me. I am live from Media City because I'm recording one of those first podcasts that Dominic has just mentioned. So hopefully the Wi-Fi is going to hold, because I'm actually running it through my phone at the moment. So if somebody could give me a thumbs up just to let me know that you can hear me okay, that'd be brilliant. Just looking for, I've got to see some nods. Wonderful. Thank you so much, everyone. Thank you, Jonathan. I can see it all. That's brilliant. Okay, so I'm with you for the next 15-20 minutes or so. Some of you I've already met because I've been working and speaking with kind of our practice manager network for about 2 years now. And hopefully you'll be able to get something new out of this. I'm going to kick off with a mentee. Does that sound all right? And see if I can get it to work. Okay, so apologies, everyone. I'm going to put the link and the code in the chat, and while you're finding your way into there, I will share my screen. Just bear with me 1 second so you can see, hopefully you can see that screen there. So it's www.mentee.com, which you've just heard, and the code for this poll is 8047 5369. So we're just going to do a quick pulse check with you. That's 80475369. I'm going to move on to the first slide, and the code is still at the top of the screen, so you should be able to see it while we move through. So the first question for you is, what 3 words would you use to describe your focus, your motivation, your energy right now? How are you feeling? How are you doing at the moment? And you might want to refer to today as a particular instance, or just generally how your week's going so far. Brilliant. So immediately we've got people who are tired, worried, overwhelmed, information overload, swamped, stressed, had enough, hopeful. Yeah, it's coming in thick and fast now. Some people are happy, some people haven't got any staff, people are fed up. There definitely are lots of continuing running themes: drained, unfocused, low, enthusiastic. So we've got some difference there. Survival. I'm assuming you mean you're in survival mode at the moment. Yeah. The 3 key things that are coming through at the moment are stressed, tired, and overwhelmed. And that's coming through really loud and clear. Okay. I'll just give it another 10 seconds and then we'll move on. Looking for a new job role. Okay, thank you so much everyone for sharing some of that insight. The next question is, what are your biggest challenges and concerns? I suspect we can probably get the key themes, but it'd be really great to get a little bit of an insight from you right now. What are the key things that you're trying to tackle? It's all there, isn't it? Staff retention, keeping people happy, responding to the winter pressures, keeping on top of all the info, people's expectations, patient expectations, winter pressures, absolutely, vaccinating patients, morale, staffing, safety. Yeah, staff retention, workload, and winter pressures are definitely the key themes here. Partnership broken. Gosh, that must be hard. Flu clinic collaborations, missing something important. Absolutely, with the kind of the tsunami of information going on at the moment. Emails, PCN pressures. We've got morale a few times, firefighting. Yeah, so again, referring back to that survival mode earlier on. It's really tough at the moment, isn't it? Okay, keeping people, safety is there as well. We can see that. Spinning all the plates. Okay. And finally, thank you so much for that, everyone. Finally, what do you need right now to help you and your team's well-being? Sorry, I've missed a mess off there. What do you need right now to help you and your team's well-being? A new job, says somebody straight in there. Okay. Media recognition, a holiday, staff, time out, rest. Split myself into 10. Don't know if that's the well-being solution we're trying to look for at the moment. Suspend standards, good pay rises, happiness. Not sure what the answer is. It's a very honest response. Bureaucracy to be removed. Trust in the work we do. And I wonder if that's trust from our patients, trust from our politicians, our media, each other, I don't know. NHSE understanding. Again, we've got mention of morale here. Yep, support from the government. CCG understanding, pay increases. So we could have predicted some of this stuff. Some of these things are in our gift. Some of these things are out of our gift. But it's really important that we acknowledge and pay attention to what's going on and where we are at the moment. Brilliant. I'm going to stop sharing that, but I'll leave it open. So if you've got any thoughts that are going to come through, please just keep adding them because it will be running in the background. So hopefully you can see me again. Hello, everyone. Okay, so I'm here to talk a little bit about the Wellbeing Toolkit, but actually what I'm really here to talk about is how we can create better wellbeing cultures in our workplaces, because there isn't any point trying to fix individuals and put lots of provision and practice into place if actually the environments which are creating the challenges and the problems in the first place aren't being tackled as well. And I know working with colleagues like Anne and Dominic and the team in primary care, we're collectively looking at actually what do we need right now in terms of those interventions and that support. And we heard some of that from what you've just shared. But actually, what are the things that we really need to pay attention to actually create some sustainable change? Because there's no point trying to support individuals if like I've said, if we then keep sending people back to those same environments with the same pressures, the same challenges, because we're just going to keep going around in this hamster wheel. So hopefully you'll get a little bit out of the work that I'm just about to share with you. And this is an ongoing conversation. So what we really like you to do is continue this dialogue, pick up the phone, send an email, talk with all of us about all the things that would help you from a practical basis right now, but also what do you need to help change your workplace cultures moving forward. So I'm just going to share my screen and go through some of these slides very quickly. You will get a copy of these slides. There were lots of hyperlinks in here, so you'll have time to have a look through it if you get a moment. If there's, we've also got workshops that are running as well, so if you or any members of your team want to come along to those, then please do have a look. Okay, so we do have a Greater Manchester Wellbeing Toolkit. I really do hope that you've all had an opportunity to have a look at it. There is absolutely jam-packed with lots and lots of practical tools and tips. We've got templates about how to have good wellbeing conversations, the kinds of things that you can put into place on a practice, how to do some day-to-day wellbeing. Oh, hello.
Recorded for training and monitoring purposes. Please note all calls are triaged and you will shortly be put through to one of our care navigators who will ask you a few questions to help us offer you the correct service for you. Please choose from the following options. Press 1
Can I ask
for
if you want to put themselves on?
Press 2
Hello.
for test results between 12.
Thank you so much for that little laughter there. I don't know whose that was, but thank you so much for putting yourself on silent. I could see some smiles around the room. So so that was great. So yes, haha, indeed. Okay, I shall carry on. So we've got this toolkit. The toolkit is broken into 3 sections. It's broken into how we look after ourselves, and we're really rubbish at that, quite honestly. We're so busy looking after other people, we pay less attention to how we look after ourselves. It's really important that we do that. The biggest section in the toolkit is about how we support others. Now, that might be whether you're a line manager, whether you're supporting your peers, whether you're a great colleague, whether you're supporting people inside, outside home, all sorts of different things. We've got some great support there. And the third is responding to needs. So it's those aspects where we know there is a huge amount of support out there. We've got support offers from national, we've got things that are happening regionally, we've got things that are happening locally within your localities, all sorts of different things. And what we wanted to do was make sure that rather than having to go to 10 different places, we start having a collated kind of space where you can go to and find where that support is. So we've got everything from physical, mental, practical. So you can see on the side there, the 3 aspects of wellbeing that we talk about. So we're really lucky in Greater Manchester. We've got Greater Sport who do lots and lots of physical things. How to build a 10-minute walk into your day, which actually we know will help your physical and your mental well-being. Some of the practical aspects, car parking, bike schemes, making sure you've got proper food to eat, you're getting proper breaks, all sorts of different things. We've got some of the guidance around that as well. And then, of course, psychological and mental well-being. So please do have a look at that. I've included some of the links in this slide deck with all the hyperlinks. There's a lot more in the toolkit, and there's also a one-pager which I'll make sure that we get circulated around to you. If you haven't had a look at the toolkit, there is a little hyperlink at the bottom of this. When I get a moment after I finish this, I'll pop it into the chat as well for you. Okay, who recognises this? I know that on a day-to-day basis, I'm like the container that's on the left side of my screen. I wish for calm waters. I wish for kind of structure and order and consistency and blue skies. But actually, I know I certainly am lurching from left to right, being really, really responsive. It feels like you're firefighting one thing after another. Somebody mentioned survival in the mentee, and it's really important that we absolutely acknowledge that and talk about that openly, because if we keep it contained, it just feels a little bit too overwhelming. Okay, I'm not going to go through this, but each of these little kind of images is hyperlinked. We've got lots and lots and lots of resources in the toolkit. Please do have a look through. You've got some quick clicks through here. I just wanted to make sure I highlighted the buddy guide, which is a peer support kind of approach. We know that it's in practice in a lot of different settings, including primary care, and it's getting some really great support as well. So it might be that you link up with somebody. It's like having a pen pal. You might link up with somebody in the same practice that has a similar role, or it might be that you link up with somebody in a different practice who's doing the same role as you, so practice manager to practice manager within the same locality. But you've got somebody there who completely gets where you are, completely gets your challenges, and gives you that safe space to be able to just go, oh my goodness. Because we all know when we talk about things, it feels so much better. So I would really encourage everyone to think about what a buddy system looks like for you, what a buddy guide looks like. Some primary care colleagues have started to call it tag, so you're tag teaming with each other. I absolutely love that. I've included that in there. And the buddy guide here that we've got in the toolkit actually has some do's and don'ts, what a buddy is and what a buddy isn't. A buddy isn't there to fix anything. A buddy isn't there to solve somebody else's problems. But a buddy is there to pay attention, to just check in with somebody, to have some non-judgmental listening, and provide a bit of a safe space where you can just talk about things. It's really important. So please do have a look at that. I'd really recommend that. And I talk a lot about how you, as individuals, can pay a little bit more attention to taking care of yourself and your teams. Being kind to yourself and others is really important. I mean, we talk about, there's a lot of conversation in our society and in our media about kindness and compassion. But actually, what does that really mean in our workplace? I know for some colleagues, that means that actually when we see somebody having a bit of a tough day, we make them a cup of tea. We might not have a conversation with them, but we just bob the cup of tea in front of them. And actually that person knows that they're supported and they've got people around them who are there to stand alongside them, even though they might not be able to fix what's going on. Pay attention to what's going on around you in terms of behaviours, and make sure that you spot each other. You basically look out for each other. Has that person had a break? Have you had your lunch? What was that like when your child had their significant birthday? Or are you going over to the car park? Shall we walk over together and have a quick 5-minute check-in? Little actions on a day-to-day basis make a massive difference. And I know you all know all this, but actually we do need a reminder to put some of this into practice and place. Proactively managing your stress and anxiety. I'm not even going to ask whether anyone's feeling stressed or anxious. I think we all are, and we're living with it on a regular basis to the point where we don't even realise that we have it. It has an impact on not only our mental well-being, but our physical well-being as well. So aches and pains, shoulders, back, our legs are feeling pins and needly. All of these things are signs of stress and anxiety. So do things that help you and make you feel better. Some people run, some people dance, some people connect with others. Also, you'll know the things that work for you. So just pay some conscious attention and do a little bit more. Socially distance, but don't isolate yourself. I still don't quite know what the rules are. We've still got COVID out here, but the guidance is saying one thing. I'm still wearing a mask when I'm out and about. I am socially distancing where I can. But please don't isolate yourself from each other. Do keep talking. And if there's one thing that I would encourage you to do, is talk to other people and extend your listening skills to people so other people can be heard. So do that for each other as your colleagues, your peers. Keep calm and don't always carry on. One of the big things that's come through all the work that we've been doing is actually with the last people to say, actually, I need help, or I need to stop, I need to take a day out, just to kind of recoup and refresh myself. Don't keep going until you start falling down, because actually you're not going to be doing yourself or anyone else any favours. So look after yourself and do the things that actually, and I've put it there, that feed your heart, that keep you passionate, that keep you engaged. Some of the feedback in the mentee was about feeling low, the morale kind of not being that great, wanting to feel happier, all of these things. Pay attention to what does that for you and do a little bit of it. make some time to do that. And keep looking up. I know it's really, really hard at the moment, but we are in a transition period at the moment. Things are going to change. We collectively need to kind of look after each other and get through this winter period, and the world will start hopefully looking brighter at some point. And I talk quite a lot about, I won't go through all of this, but I talk quite a lot about the stress bucket. So we talk about stress and anxiety. And all the daily things that you've listed and outlined there are coming through that tap at the top. Drip, drip, drip into our bucket. So it's not one big thing that's making a massive impact. It's actually all the day-to-day stuff that's kind of layering up in that bucket. And what we're actually talking about is making sure that that bucket doesn't start overflowing, because that's when we know that we're in trouble. So pay attention to that tap at the bottom. So when I talk about your individual wellbeing strategies, how are you looking after yourself? How are you paying attention to what you and your colleagues, your teammates need around you? Is actually, how do we turn that tap on at the bottom to make sure that we get some of that flow? I mentioned earlier on that actually some of those pressures and concerns that you were talking about, some of those things are in our gift to change and others aren't. So we're never going to really be able to stop that top tap dripping. But what we can do is really think about what we're doing with that bottom tap. And that's what our wellbeing strategies and our wellbeing cultures are all about. There's a brilliant tool in the toolkit to help support people kind of navigating through anxiety. It's what's in your control. It's dead simple. You need a pen, a bit of paper, and all you need to do is draw a circle. And there'll be things that you can do, take some action towards, and there'll be things that actually impact on you, that might be frustrating you, that might be causing concern or worry, but actually you can't do anything about them. So by writing it down on a bit of paper, you're almost, anyone who's a list maker will recognise this, you're almost kind of acknowledging what's there, but you're putting it to one side. So focus on the things that are in your control. What can you do about the patient support that you're providing? What can you do about supporting colleagues? What can you do about the information and the kind of the processes that are going on around you? We might not be able to split each other up into 10, but what we can do is figure out, actually, we've got these 3 key actions, we can prioritize them. So think about what is going to help you most. Please do use this exercise. It's dead easy. And like I say, at the bottom left, you can see that the direct link to the toolkit is there. It's a really useful tool just to help organise thoughts and help some of that anxiety and stress that people have kind of been mentioning. And when we're talking about shifting our workplace cultures, because there's no good about us working on ourselves if the environments around us aren't changing, then actually what we really need to do is think about how we can work very differently over a sustained period of time. Tackling better well-being, tackling better work cultures isn't a simple undertaking, because we've got a legacy of how we do things. We have systems and procedures and the way we do things around here. So we need to pay some attention to that. My recommendations would be, keep things really simple and clear. Nobody wants to read 10-page documents. Nobody wants things that are complex. So keep it simple, keep them small actions. From a wellbeing perspective, please focus on that physical, that practical, that psychological, and do things that you know support people, and make sure that you include everybody who's in your workforce. And when we're talking about all of this, think about the key question: what is it that keeps you at your best? Feeling at your best, mentally being at your best, and how do your actions then demonstrate how you're feeling to others? So we know when we have a good day, we're a little bit more smiley, we're a little bit more generous with our words. When we're having a bad day, perhaps we're not so much. So think about the impact that can create for ourselves and also for others as well. Another great tool in here is the check-in, check-out. We do technical debriefs, we do clinical handovers, but we don't do psychological ones. We don't check out with ourselves. So think about how you can do that debrief for yourself, but also for those colleagues around you. And again, in the toolkit, there is a link here. There's a little bit of a guide about how you can do that. So 10, 15 minutes, check in, bring closure to your working day, and then so you're able to go home and be present. And the one thing that I would ask everyone to watch out for is, if work is starting to impact on your home life, your home relationships, you need to think about that balance. Really need to pay attention to that. So this is a really great tool to just help us compartmentalise some of that. The next couple of slides I won't go through, but this is where these are all hyperlinks. So there's lots and lots of support here. I will highlight a couple of things. So we've got some suicide prevention training. It's 20 minutes. Please encourage all of your colleagues to take part in this training at some point. It's just a great awareness to have. It might be that we need to support somebody within the workplace or at home, or you might be individually, we're just struggling ourselves. So please do that. Have a look at the Greater Sport Active Workplace Toolkit. It's brilliant. It talks about lots of practical things that you can do as working challenges, or all sorts of different things. So please do have a look at that. And they're running some brilliant workshops. If you want access to that, we'll make sure we get all that info shared. We've also got a Greater Manchester mental health toolkit that's been provided. And of course, I'm going to talk about the Greater Manchester Wellbeing Toolkit because, of course, that's the one that we've provided. Think about what your occupational health and EAP is also providing there. And of course, we've got support from our national colleagues. Don't forget, we've also got our resilience hub. So if you do feel like you need some clinical support or some intervention, you don't have to wait for a manager to refer you. You can actually do it yourself. We've got some links in here. It's completely discreet. So you can do it in whatever kind of circumstance you want. So it might be for yourself, or it also might be just to share with colleagues. I would really recommend, if you've got a bulletin board at work in your staff room, just make sure that you put some of these links onto there, because actually somebody might see it at the right moment when they need it. The other space that's really great, backs of toilet doors, because where do we all go when we just want that quiet moment? I know we're all kind of laughing about that, but the backs of toilet doors are an amazing way of communicating some of the support out there. And then, of course, we've got other support. So we know that financial well-being is incredibly important. A number of us are under a lot of pressure, financial pressure at the moment. Some of us might lean on our communities or our faith groups. If you've got that support around you, that's brilliant. If you haven't, we've got networks and networks of people. So, for example, we're doing some work with our Interfaith Chaplains Network, and we've got faith chaplains from all across the board. And we're supporting and training them up in some of our wellbeing kind of ways, so they'll be a little bit more aware about mental wellbeing and domestic violence and physical activities and all sorts of things. And actually, they're available to come and support you in your practices, or for you to be able to access them. So if you're interested in that, please get in touch and we'll connect that. And of course, some people might look for support from the LGBT Foundation as well. And we've got some links there, and we're going to be running some masterclasses with them later this year. So I'll make sure that information goes to you. Right, I'm mindful that I'm just coming up to my last slide. So I've got a call to action. I never walk into a room with a group of colleagues like yourselves without coming in with an ask. And my ask is, have a think about what is it that you're trying to do in your workplace to really create good wellbeing cultures for you and your teams on a day-to-day basis. Pay attention to what you've already got, and pay attention to what you need, and put those asks in. The work that we're doing, the work that Dominic, Anne and the team are doing, really important, because actually it's all driven by the feedback that we get from you. So please do make sure you do that. You've got lots of links here. I'm sorry for the person who said information overload, but do kind of have a look through the tools, because they're here to help you. And if there are ways that we can make it easier, please let us know. And please remember to look after yourself in all of this. That's one of the most important things that I can suggest that we get you to do. Okay. Hopefully that's been helpful. Hopefully it's been a little bit of a reminder of well-being. I know some of you have heard that already, and you've got something else out of it. So I will just stop there. And if there are any questions, my email is also there as well. So please feel free to drop me an email. And I'll hand back over to Kerry.
Oh, thank you, Shenny. Genuinely, I've heard Shenny's presentation on a number of different occasions and in a number of different forums, and every single time I always take something away that's different. So thanks to Shenny, I literally now implement a virtual going out in the morning and doing a walk on my commute, and the same in the evening, because I literally was not doing that, and I'm sure, like many of you, kind of just chained to your desk. So thank you, Shenny, that was great. In terms of Shenny's slides, we will be sharing them as part of the information that goes out. So don't worry about missing any information. It will be coming available to you. So fingers crossed, we think we've got mentee fixed, but bear with us. So if we can ask you, in terms of helping supporting the other presentations, if we can ask you to go back to mentee again. But it's a different mentee than the one that Shenny gave to us. It's I'll reread the code for you. It's 28283214. and you should, I'm hoping, be presented with the first question. So I'll share my slides. Now, if you recall, this was from Dominic and the health and wellbeing work that he's taking forward at the moment with their colleagues Angoff. And they're really keen to understand what's the best way to communicate to you. So I can't actually see the chat anymore, so I'm just going to be reliant upon my colleagues, Johnny in the room. If anybody's got any questions, just checking that you can actually see the right slide now.
Yeah, we can, Kerry. Thank you.
Oh, thank you. So what's the best way for GM Excellence to communicate with you? Is it by email, or I know we were kind of talking that that's probably not the best way at the moment. Is it kind of through short meetings like this where they can come and feed back to you, and you can feed into the group as well? So are you all submitting, or is it just me that I can't show that you're not submitting? So failing. Because I'm also doing this on my mobile phone.
Can I just check the code again, please?
Yeah, I'll just have to swap slides. So it's 28283214. I'll be honest, I've submitted something saying not email. It's not kind of appearing on there. So hopefully we'll get this in the background. Not how Mentimeter is supposed to work. The next question is, what are your wellbeing priorities? Is there something that Shani's spoke to us about today that actually you think that's a real priority for me and that will help inform the work that Dominic and Anne are doing, that you'd kind of like them to investigate further? If you could take a moment to respond to that particular question, that would be great. And then I will move the slide on again. What do you think are the barriers to communication at the moment?
It's not allowing you to go on to the next question, Kerry.
Oh, is it not? Do you want to pop in the chat for me then? What do you think the barriers are to the next? So I can move on, which is great, but it's not allowing you to move on. Okay, so I've got it up on my phone actually, and it is, even though I am moving on, it's kind of, I'm going to refresh my screen. No, it's still not letting us do it, is it? Okay, no problem. I think we should maybe try Mentimeter on another day. If you could put in the chat for me in response to the questions, that would be really, really helpful. And then we can look at the chat and then we can collate it. So any barriers to communication at the moment? Oh no, sorry, I'm on the wrong one, aren't I? All right, thank you. Too many meetings to attend. I know there's a million meetings, isn't there, at the moment? Anne's got a hand up. Anne, you're on mute.
I'm on mute. Hi, Kerry.
There you go.
Unfortunately, I need to leave now because I've got another meeting. But we'd love to hear from all of you. Any ideas? We're open to suggestions. The services for staff. And please contact Dominic or myself through the Primary Care Excellence website, and we'll get back to you. But please, just no ideas are ridiculous. We're open to suggestion. So please get in touch with us. It's lovely to be invited. Thank you.
All right,
See you all
thanks, Anne.
soon.
And we'll collate the comments in the chat for you and feedback to you and Dominic.
Great, thank you.
All right, thanks, Anne. email seems to be a real common theme, actually, doesn't it, in terms of communication. I think we used to rely heavily upon them, and it's kind of gone into overload. So just moving on to the GM Connect, in terms of the kind of your profile being visible, we absolutely can put a fix on that, so you're not getting spammed or not getting contacted. But in terms of when you are recruiting, are you happy for your name and email to be included in the practice profile? Is that something that's okay to be included, so people can get in contact with you? If you can just give me like a yes in the chat, that'd be great. If not, we absolutely can remove the emails and the names, and it will just in the background. Okay, yeah, brilliant. Fantastic, thank you. And if you have got roles at the moment, which roles are those? Which roles are you looking to recruit? I think I can probably guess. But which roles are you looking to recruit? Is it AMP, GPs, admin? All right, fantastic. Okay, brilliant, thank you. Can I ask about the R's? Is anybody looking to recruit any R's? I know you're also common theme, AH, it's kind of around GP and the nursing career pathway. Anybody looking to recruit any R's roles? All of them. Okay, clinical pharmacists. Okay, that's great. I know premises is a huge issue as well, isn't it, in terms of rooms, allowing, freeing up some rooms and having some capacity in order to take on these new roles. We absolutely hear that, and we have been feeding that back as well. All right. Okay, that's brilliant. So in terms of kind of the GM Connect, and in terms of job roles and job information, if we created a peer network in the background, would you be willing to share kind of job descriptions and things like that with your peers, your other practice managers across Greater Manchester? Simple yes or no is all we need to see. We're just wondering kind of if we could kind of help share information, really. So if someone's done a great job description, so you'd be happy for that to be shared. That's really helpful. Thank you. Oh, I wish we could capture this on mentee. And then final question. Okay, that's great, Anthony. That's great to hear, actually. FPM, I've got lots of information already. All right, that's great. We'll make a note of that. And in terms of, do you think you're going to use GM Connect, i.e., do you think it's going to help you save time? Simple yes, that would be great. Practice index as well, Brill, thank you. All right, fantastic. Okay, so you can keep popping your response in the chats if you like, and I'm going to actually share my screen. So in terms of you're all looking for a GP, potentially here's something to help. Fingers crossed. So I don't know whether you are familiar with the skilled worker visa, which is basically what we historically refer to as Tier 2. So within Greater Manchester, we know that the skilled worker visa is the main immigration route for skilled workers who are coming into the UK. And actually from the 1st of January 21, that also included EEA citizens because of Brexit. It's got some great advantages. So it would help with kind of workforce planning. It gives you that extra opportunity to reach out to candidates and attract candidates into your workforce. And what we do know is, in particular, in relation to GPs, where we've got international doctors that have gone through our GP training programme, when they do that and they're kind of in that training period, they're currently sponsored by Health Education England. So it probably doesn't come to your attention, and it's not something that you need to worry about if you're a training practice. But actually, in terms of those individuals, once they qualify, and if they haven't been in the country for 5 years or more and aren't yet able to apply for the right to remain, they need a practice who has a skilled worker visa, or a tier 2 visa is kind of what I normally refer to them as. So that means they can only go and work for a practice that is either applying for or has already applied for the skilled worker visa. We know across our qualifying doctors, we know that approximately, wait for this, a third of our doctors need a tier 2 license. So that's shocking, isn't it? So we're actively trying to help practices to obtain the license. It's a really simple process. It's an online process, and I'm informed, as long as you have your supporting documents, it literally should take you about 30 minutes to complete. And then once you have the license, actually you've got it for 4 years. So each year you could continue to reach out to those doctors that are about to qualify and attract them into your practice as a recruitment offer. So unfortunately, NHS England ceased the reimbursement of the fee to practices for the licence. However, the great news is that Greater Manchester have an allocation of money that we're using to help practices and reimburse them the cost. So it can be quite significant. It can vary from anything from £536 to just over £1,500 for a medium organisation. So that's actually to get the tier 2 licence. And then on top of that, the certificate of sponsorship cost is just short of £200. So in effect, it could cost you £2,000, but that is all reimbursed by Greater Manchester. The other thing that we're hoping as well that would help support you in order to get this licence is that we've got a dedicated helpline that's linked to a solicitor who has all the knowledge and the expertise and can kind of talk you through the process. So, bit of reassurance, we know that this year alone, of those people that we've supported, we know that we've managed to retain 14 doctors that have qualified this year. So that's 14 practices across Greater Manchester that have got a tier 2 doctor. And we know that we've got 67 Greater Manchester practices that currently hold a licence. There's lots of opportunities. So we promote when we go out to the training programmes and we speak to the doctors that are about to qualify. We actively ask them to contact us where they're looking for a tier 2 practice. So we've got a great dialogue between ourselves, the GPST3s and HEE. And we're hoping that this work will also be linked into the GM Connect. So practices, when they register on the GM Connect, they'll be able to indicate that actually they also hold a tier 2 licence. The feedback that we've had kind of in these little orange bubbles at the bottom has been really, really positive from practices. And where a doctor does contact us that needs a tier 2, we actively push those out to those practices that hold a licence. So as I say, it's a great opportunity for maybe linking into a group of staff that you might not have had access to before. So this slide is the information that you need when you're going to register. This is something that Alex, the solicitor, will help support you with. So I know that slide's a little bit busy and there's a lot to take in, but it's something that he will be able to definitely support you with. And if you have all the documents in place, we're reliably informed that actually setting up the accounts on the online system literally takes 2 moments or 2 minutes, and then completing the application takes 20 minutes. After that, it takes between 4 to 8 weeks for the application to be approved. So if we're thinking about those doctors that are about to qualify in February time, now would be a really great time to start this process. That's the cost there. Again, just to reiterate that Greater Manchester do have the funds to reimburse the costs, and that's a really straightforward process. You basically just send me your evidence and we make sure that it goes through on your monthly payment. There's additional information there. And then in terms of the Mentimeter, the question that I have to ask you, which hopefully you can put in the chat, is this of interest to you? Is this something that you'd like to explore? Simple yes or no. Again, I mean, I can't really stress enough. It's about really accessing those doctors that need a license, really, of which it's about a third of our doctors are about to qualify within Greater Manchester. So if you could just give me an indication in the chat whether or not you think it's an offer that would be of interest to you, that would be really, really helpful. I actually think as well, I think I thought I saw one of the practices that hold a license with us at the moment. But no, I don't think. Suzanne Holland, Suzanne, do you hold a license? Am I putting you on the spot? I can't remember.
No, we don't. We were looking into it, Kerry. Then I don't know what happened, but right. Yeah, we are interested. There is a practice manager that says they already have one, Karen Anderson.
Okay, brilliant, Karen. And I think so. Karen will be able to tell you about how straightforward applying for the license was. I don't know whether it's when at the time that we had Alex in as a helpline, but certainly I think that will definitely help with the process and the reimbursement of the funds.
So no, probably not, because I did mine about 3.5 years ago.
Oh, so you went through the pain.
It was awful.
Oh God.
Very, very complicated. The terminology in it was really one of the stumbling blocks for us. But once we had done it, then we thought, oh, actually, it wasn't that bad.
Right, okay. Well, we're actually going to do, Alex is going to do some webinars for us, and it's going to be little YouTube videos where it talks you through when you go through the application process. Because, I mean, Karen's feedback isn't uncommon in terms of, you know, what it was like 3 years ago. And, you know, it's not made easy, is it, these things? But I think if you kind of can have like a little bit of a instruction manual, and then you can be prepared, you know, hopefully then it only does take 20 minutes. Thanks for that, Karen. Okay. Anybody got any questions?
I'm not sure the chat around. Is this only for a doctor, or can they have nurses within this, or can they apply for a nurse?
So in terms of tier 2, that's thanks Johnny. In terms of tier 2, the nursing pathways are a little bit different. So I think it would really depend on how long the nurse had been within the country. So if she's not been in the country for 5 years, then my understanding is yes, you can use the tier 2 also to attract nurses. But they will be newly qualified, so we'll probably need to support them with the foundation nurse offer that gives them those fundamentals. So, you know, goes through long-term conditions, ins and backs and cytology. So we probably just need to align them to that as well. But my understanding is that actually nurses and doctors are on the shortage occupation list. So Janine's giving some feedback. We have 2 tier 2 GPs. They're both fantastic, brilliant. That's really, really great to hear. Thanks for that feedback. That's great. Okay, so if nobody's got any other questions, hopefully Sam Howard is in the room, and she's going to talk to you around pharmacy technicians. Sam, are you with us? Hi, Sam.
Hi, I'm Kerry.
All right, I'll hand over to you.
Kerry, I'm going to attempt to share my screen. I say attempt because it never goes well, does it? So thanks so much for inviting me. Thanks so much for your time. My name's Sam Howard. I'm one of the clinical leads from the Greater Manchester Training Hub, and I'm leading on the multi-professional GP Ready programmes, and specifically on the pharmacy technician GP Ready programme. So can you see that, Kerry?
Yes, and we can see that. Yeah, you're not on the slideshow, but yeah, we can see your slides.
Okay. Is it clear enough? Is it large enough? You should be able to read that.
Yeah, it's okay. Can you go on the slide? Yeah, there you go. That's brilliant. Perfect. Thank you.
It's worked. So the team is made up of quite multidisciplinary, and I'm heading up the team, and I've put the course together with a handful of my colleagues from different backgrounds. So we've got Sian, who's working with us, who's a clinical pharmacist in practice. She's got bags and bags of experience. She's fantastic. We've got Cora, who works with me. She's one of our advanced nurse practitioners. Sarah, who's a registered nurse adult, that's RNA is an abbreviation for registered nurse adult branch, that's an NMC terminology. Ricky is our lead physician associate, and we've also got a GP, got Dr. Kelly who's working with us, who's also a medicines management lead, and he's working alongside us, doing some advanced IT skills and embedding things into practice. So you can see we've got this really good skill mix backing this up to work with our pharmacy technicians in general practice. The purpose of it really was to optimise potential. And within the GP Ready programmes, one of the things that I've always felt really passionately about, irrespective of programme, is to try and align certain things that we all need in general practice, because we're a specialist in our own right. It's this fantastic opportunity, and I love general practice, and anyone who knows me knows I'm really passionate about primary care. But equally what it brings with it is this risk of isolation. That autonomous role also has this potential to make you feel really alone and isolated, and certainly through the pandemic period, we've all really felt that. So what we wanted to do is support all of our professionals with induction, peer support network, some clinical training, which this programme's got quite a bit threaded through, and also enable everybody to do some kind of quality improvement in practice so that we can really make a change and make a difference to patient care. So the topics, is a 20-week programme, and I won't read through them all, I'll just give you kind of highlights to that, and it kind of builds up of the skill mix that we would need for general practice. And I'm happy to send you the slides through all the programme format so you can all digest it at your own leisure. But you'd be almost forgiven for when you're looking at this thinking, is that a HCA training course? And I'll always open with that, because I always think that's the initial fear, that it could be something that we've already got. But actually, if you look at that, it could be a HCA course, but it could be a nurse course as well. And it also could be a pharmacist course. And actually, if you change some of the terminology, that could be a course for GPs as well. Because the topics within this are aimed at pharmacy technicians, and these are general practice skills. These are skills that we all need and use within primary care, within our day-to-day jobs. And some of the things that are in there that I think are really innovative and really forward-thinking are things around the clinical skills. And there's two reasons for that. It was double-fold. One was the clinical skill behind it, so that we can make every contact count. And if we've got these really skilled professionals reviewing a patient that, for whatever reason it is, because typically the patients they will be seeing are at risk of something, aren't they? They'll be on a high-risk medication or need something monitoring. You wouldn't then need to send them away, say, to have the bloods taken or venipuncture sample taken. They might be working in your network as part of the warfarin clinic. And as any of you will know, that if you have patients who attend for a capillary INR, if you can't obtain that for whatever reason, you need to do a venous sample. So there's things like that threading it through where it could really fit. So DMARD monitoring, INR, as I've said, any other kind of high-risk drug that needs something to be checked. Then the other part to this is actually it keeps the job really interesting. So the feedback we've had from the pharmacy technicians is that they're really quite excited to do something clinical, something new that they've never done before, something a bit more interesting. So there's that flip side to it as well, to keep that excitement in their own role. My screen's frozen. I do apologise. I can't seem to. There we go. So the last few sessions around embedding their role in practice. So I've included things around the enhanced services and how specifically that would fit with pharmacy technicians. And we've even took the leap of adding in some immunisation and vaccination training too, so that we've got this really broad skill for our pharmacy techs in practice, so they can really have got a wide plethora of skills. We've included leadership and quality improvements, as I've said, in all the programmes. So there's just professional development. And it's just so we can really think through it pragmatically, where that role would fit, how practically what skills would they need? And then how could they implement change? Because we're all from general practice, and I've worked in general practice forever, it feels like now. And historically, we've all been part of some kind of almost quality improvement, something that wasn't really a true one, about embedding change. And it's easy to think that something's just a fire and forget, and it's done once and then you fire it off and we never look back. But to really implement change, to really embed that into practice, you need all these skills so they can work as part of this effective team. So the benefits to you guys as the employer would be, we've also put together a clinical supervision resource as well. So there's some financial things you can access as part of a PCN level package, which that's a topic in its own right, but we can send you through. I'm sure your network should have already had that information. It really is to embed the role into practice so that they can utilise every single skill they've got and really optimise everyone. And one of the main aspirations is that we can really relieve that practical burden of training en masse across GM, so that we've got this one protocol, this one central point where they can come to us and have this standardised training. Any questions?
So Sam, we did have a little bit of an issue with Mentimeter earlier today, where your question presented first. I was just going to say, actually, I just reviewed that, and there was we did ask the question around, have you already employed a pharmacy technician? It did seem to be the first question in Menti. And of the 12 people that did reply, 3 have, and 9 haven't yet. So I suppose if you can share your slides, we'll make sure it's part of the slide deck, and people can contact you directly if they want the pharmacy tech to access this program. Is that?
That'd be fantastic.
All right,
that'd be really good. Great, thank you.
Anybody got any questions for Sam? I know we're just about to approach past. Okay, no problem. So thank you for coming today. I'm just going to share just my very last slide, which is around the next meeting. So the next meeting is planned for the 2nd of December. If you'd like something to be on the agenda, then please do send me an email and we can make sure that that can be headlined. We haven't set the date for January. We're just a bit conscious that the first week after kind of in January is normally taken up, so it might be the second week in January. What we would say is, if you would like to follow us, there's always lots of information that we're sharing via Twitter. The Twitter handle is there, at Primary Care GM. And then one final comment from me is that in terms of the NWRS and last month's presentation from HEE and Ian Thornber, he has shared with us that there are some very short webinars and very short films that are available to help support you in terms with NWRS. Again, I'll make sure that that's shared as part of the slide deck that comes out to you. But thank you so much, everybody, for coming along today. And unless you've got any questions, we'll let you get on with the rest of your day and the rest of your week. Thanks very much.